In this video, Dr. Randy Beahrs from Metro Urology in St. Paul, Minnesota, will share his experience in managing patient comfort for in-office procedures.
Hello, I'm Dr. Randy Beahrs. I'm a practicing urologist in the Twin Cities with Metro Urology. Over the last 10 to 15 years, I've been involved in office procedures, minimally invasive procedures for BPH. And in an effort to make these procedures comfortable for my patients, I have been working on different protocols for pain control and pain relief during the procedure. So we are currently looking at a video of a patient that's about to have a minimally invasive procedure. This is the transverse view of about a 30-gram prostate. The patient has quite a large median lobe. This is the sagittal view. And you can easily see the seminal vesicle, and the traditional site of Mont Blanc is a little bit underdeveloped, but the most important part that we're seeing are the white clouds above Mont Blanc, which is where we really want to put at least 4 to 5 cc's of our xylocaine. So on the picture you see the bladder and you see the prostate, seminal vesicle, poorly developed White Mountain, but a very nicely developed clouds above White Mountain. So we'll move ahead now. I've showed you both sides of the prostate, and in just a moment I will use a 22 gauge needle and inject about 3 or 4 cc's into the White Mountain site. You can see my needle advancing here now. There it comes, 3 or 4 cc's of xylocaine. And then I pull back a little bit, put a little bit under the prostate, and then go lateral and go above White Mountain into the clouds and put another 4 or 5 cc's. You can see it going in there now. And that only added about 5 seconds to the procedure. We go to the other side now and do the same thing. You can see my needle coming into the hyperechoic area that we affectionately call White Mountain. Put about 3 or 4 cc's there. Here comes the needle. And then I pull back a little bit, get some under the prostate. And then you'll see the seminal vesicle disappear as I go lateral and go right above Mont Blanc into the clouds, another 5 cc's of xylocaine. And that's the block. So these patients are given Cipro 48 hours ahead of time, taken off all anticoagulation and aspirin. The first 3 or 4 cc's go into the traditional White Mountain site, and then I pull back a little bit, put a little bit under the prostate, and then go lateral and go above White Mountain into the clouds and put another 4 or 5 cc's. There are some blood vessels in the area running near the seminal vesicle that you have to be careful about. I think as urologists are doing more and more in-office procedures, it's going to be important for us to have good pain control for our patients. They'll appreciate it. You'll appreciate the ability to do things without patients moving or flinching during the procedure.